Well, a very warm and happy welcome to all of you. And we all need to know about our health, and Meg can provide you with lots of insights because our grantees are so specialized and so special that you give the topic, we will be able to be participating. And I would like now for us to start, and thank you so much to Vivian and Reiko for giving us this recording. Thanks a lot.
Good afternoon and welcome to MMEG Talks Health. My name is Vivian and I'm an MMEG board member. Today, as we continue the MMEG Talks we have created to celebrate our 40th year anniversary, we would like to share with you a conversation on a subject that has gained visibility and is particularly important today as the world navigates a pandemic. We are very fortunate to have two fantastic grantees to talk with us about mental health. Serena Nordian is a clinical psychologist who is currently a lecturer at the University of Western Cape and has worked in the Child and Adolescent Psychiatric Division of the Red Cross War Memorial Children's Hospital of South Africa. She was awarded the MMEG grant in 2016 while studying her master's degree in clinical psychology at the University of Cape Town. Dr. Saima Hirani has a PhD in nursing and is currently an assistant professor at the School of Nursing of the University of British Columbia. She was awarded the MMEG grant in 2015 while studying her PhD in nursing at the University of Alberta. Moderating this conversation is my fellow board member, Reiko Mimi. Reiko has a background in international organizations and public health, having worked for the United Nations and the World Bank Group. We'd like to invite you to send in your questions through the chat box. Welcome to all, and now over to Reiko.
Hi, Zorina and Saima. Thanks for participating in MMEG's 40th anniversary celebration to talk about mental health from different time zones. Let's jump right to our subject. Mental health is a term that means different things to different people. It's currently considered a necessity and a good thing to have in this time of social distancing and pandemic lockdown. Yet, mental health as a phrase also carries negative connotations. Let's start by disentangling these contradictions.
So there are two concepts basically. So prevention of mental illness, mental health disorders, and promotion of mental health, right? So when we say prevention, it's more related to the disease, the illness, the clinical diagnosis, that we don't want people to go to that end. When we say promotion, promotion is also for general population and also for those people who are having clinical diagnosis of mental illness. So once a patient is known to have depression or schizophrenia, that doesn't mean the life is ended, right? You can still promote health, still promote mental health in that person, right? Because mental health is what enhancing the mental health promotion is, like enhancing your capacities. So if person is clinically not well, he or she needs treatment or support or psychological support or support from medical health professionals. But still that person has capacity to promote health, contributing to the society, being functional in your environment. I know a few people, I've worked with few people who had mental illnesses, who were on treatment, but they were, if you don't know, no one can know that the person is having mental illness. So that doesn't mean I think this is one of the problems or the myths that general people have in their mind, that if you once diagnosed with mental illness, you are for lifetime, you are having that illness and now you cannot, you are of no use. So that's not the right thing. So prevention is one thing, but promotion, mental health promotion, like same in physical health, you want to prevent a person to get a cardiac disease. But if a person gets that heart attack once or have hypertension once, you teach those people how to take care of their diet, how to take care of their exercise, a good lifestyle. So their disease could be maintained and you can still have an optimal level of health. So similar formula is used for mental health, I would say.
So I think when I mean prevention and education, it's about preventing the potential challenges that can arise if people aren't aware of what mental health is within themselves and within their families and the communities around them. that if they're not able to recognize it within themselves and others, that can be more challenging. So what Saima was saying, if we have a mother presenting with mental health difficulties, whatever that might be, that could have an impact on how she mothers or parents. That could have an impact on how she is within her family and her community. So while prevention is not necessarily about preventing mental health, although I think there are definitely ways that we can do that, but it's also about people then recognizing it within themselves and then accessing the resources or the support they need, so that they learn that beatings is maybe not the way to go and there's an alternative. And that actually beating my child can lead to certain consequences. So in terms of the child's trajectory and where he can go in life, it might dramatically shift based on how he was parented. Because that also informs future mental health problems. So it is preventative in that sense, I think, in terms of intergenerational, but also in terms of the recognition in what I'm dealing with now, and then I can get support and hopefully I can resolve it. So it isn't something that I have to live with forever. Potentially, of course, depending on what they present with.
So mental health is both about individual and collective well-being and mindsets?
No, so both. I think within South Africa, within apartheid, psychology was used as a way of reinforcing and motivating for the status quo. So psychological tests were used to justify the division between black and white, or black and people of color. So much so that they were saying, you see, these intellectual, and so this is a little complicated, but say, for example, with intellectual assessments, they'd find a way to prove that because black people are intellectually inferior to whites, that would then support the regime. So psychology was used as a way to justify it. And I think that has, with my generation, it's certainly changed with the current generations, but with my generation, that posed a big stigma in terms of accepting challenges with mental health and what that meant about you in terms of your race. So historically, that's where psychology has been grounded in South Africa, and I think working towards it, and people have certainly done lots to work towards challenging that, and definitely has been challenged, but it called upon Black psychologists or Black people within the mental health field to actively challenge and work towards freeing people of those previously held beliefs, which, like I said, it's been over 20 years since apartheid has been abolished, if I can call it an abolishment. And within that time, there's certainly been a lot of changes, but we cannot also discount the historical roots and the historical trauma that may have been passed on through generations as a result not only of the role of psychology at that time, but also a result of the lives people of color and Black people were exposed to and had to live in.
And in Pakistan?
People live in a similar kind of a condition where there is a lot of patriarchy, male dominance is very highlighted. And now I have several stories where it was too hard to take out those women out from their houses to involve them in education and awareness on mental health without telling them that this is mental health, of course, because then people definitely cannot come, right? So yeah, I would say it's very hard generally in Pakistan, but I think if I see over the last 10 or 15 years, now trend is a little bit changing and it's a little bit encouraging because of girl child education and awareness that is raising around mental health. There is a slight difference in people's understanding, but I would still say that generally, if you see particularly rural areas or those areas where women are still less privileged, they don't have access to education and employment, they are just confined to their own homes. This is a very predominant issue there, and it's hard to break that ice.
In South Africa and in Pakistan and in many other countries, mental health professionals are scarce. What can communities, especially but not only those that are burdened with generations of trauma, what can they do for themselves to prevent mental health illness and promote healthy outlooks?
I was thinking about intersectionality and how women in South Africa have to navigate their Blackness and their womanhood, and also lack of access to resources, poverty, unemployment. So also thinking about collectively how those points of intersectionality affects mental health. And I'm particularly, as you seem to be interested in women's mental health, and I think that's led me to now think about parenting in relation to how parental mental health can impact child and adolescent mental health then. And so my PhD is around the lines, I'm conceptualizing it around the lines of engaging with parenting so as to lessen the impact on child and adolescent mental health difficulties and especially with management. So in imagining women in the context that I've worked in, and so I'm at the university now, but prior to this, I've spent 2 years at Red Cross Children's Hospital, which is the biggest and only child-specific hospital in sub-Saharan Africa. And I think that really brought things to light for me in that women in difficult contexts who have to navigate their race and have to navigate their gender are more vulnerable, I think, to mental health challenges that subsequently impact their parenting. So that was long story short, Saima, but you just got me thinking about that in relation to my context.
Mm-hmm. No, that completely resonates to what I have experienced in Pakistan. And I think that's the general picture in overall developing regions where resources are less and the burden of mental health disorders is high. Yeah, so I completely agree. I think if you see the definition of mental health by WHO, I really like that because it starts within you, right? It says that when I'm not sure how much Zorina you agree to that definition, but I see it that it's how individuals are able to or realize their capacities, to deal with their stresses and then to contribute productively to the community or to be functional in their day-to-day life. I sort of agree to this definition and would say that so it starts within you, so no matter, of course, like resources play a key role, and but I think countries or regions where we don't have much mental health resources, I think there is a lot of opportunity to develop that realization and awareness within people, bringing that using that strength-based approach, bringing those strengths out, bringing those resilience out, that yes, we can do something. And this is what I've shared my previous examples with you in my research work, that whenever I did my intervention sessions with women in the communities, I learned a lot from them. I mean, the kind of strategies that they have been using for their mental health, sometimes we never find that in books, in textbooks or in journal articles, because they have their own ways to navigate around. So that is important. So I think where there is nothing, there is always an opportunity to do a lot. So starting from there, giving those strengths to them, realizing them that no, they can do something is a key. And of course, as I said, mental health is everyone's responsibility. The community and society has a key role. I mean, if there are uneven distribution of resources, and we know, like in developing countries, like 10 years ago, there was a 90% treatment gap. So people who needed treatment, they were not able to access to that treatment. So that's huge. So if people are reached to their level when they have diagnosed mental illness, they need treatment, right? They need medical help, they need resources. But I'm more concerned about those people too who have not yet reached to that extreme, but we can prevent them. We can prevent them to reaching to that extreme of the continuum. Yeah.
Yeah, I think for me, similar to you, and I think when I'm speaking about psychoeducation, it's a preventative model. But also, so again, there's some similarities here. So I did my master's thesis on the psychological abuse in relation to intimate partner violence. And what was interesting for me was, and so then I was seeing women who are marginalized, who were staying in shelters, and these are NGOs that house them. with their children. But what was interesting for me is what we just spoke about, internal resources and capacity. So looking at internal resources, coping methods, and what they can do then in terms of resilience and strengthening in managing difficult situations when their context might not change. And what was interesting for me, though, is, and I didn't go into this looking to find this, but I found it very interesting that women use spirituality. And so I was doing mine specifically on Muslim women, but how much it wasn't religion within, as of, as it might be defined by others, but spirituality and, gaining support from the spiritual being that would be there for them and get them through this, even though their context might say something very different, and how they were accessing this internal resource to manage their situations as best as they could, I think, given their circumstances.
In the context of Pakistan, where I did my research, women had a difficult time in taking that time out. They said that now our life is over because we are married now. We have a lot to do, like the same daily routine, cooking and raising children. And then when husband comes, your all attention goes to the husband. So they could not find time for them. And even they feel that they don't deserve that. I mean, it's not needed. So I think making that realization was a key. And in our work, when we took women out of their houses, made them sit together 1 hour per week, I think that was a drastic change. I mean, they just sat and talked. What's going on in your house, what's going on in my house, and you're just sharing and exchanging their experience. I think that brought a significant difference in their mental health. So in our recent work, where I'm co-investigating with a team in Pakistan, it's we are involving men in women's mental health promotion, right? And this was one of our learnings in our previous work, where women said, you are teaching us these things. I mean, we could see differences in our life. Why don't you teach these things to our men? So that brought us to a further innovation, that now we are involving men and we are doing couple intervention. So it's hard. It's a rural area of Pakistan. I mean, it's really hard, but we see the men are now taking interest, because now you have to take the approach difference, of course, because how the intervention would be executed. We had put a lot of time and efforts in planning that intervention, because men would not come and just sit and talk to you. I mean, you have to go to the tea shops and then restaurants, maybe, those small sitting places in villages where they sit, go and just talk about it. So, and it's working. We are still analyzing.
Sorry? Could you go to the tea shop and interact with it?
Oh, no, it's a little culturally sensitive. We have to train men for that. Yeah. Yeah, but that's interesting, because initially we thought it could never happen. But I think that ice is a little bit breaking. We are still analyzing the data, so let's see if it has brought the difference or not. But apparently it seems that it has, because men agreed to at least talk about it, So, yeah. So I would just add that. Mm-hmm.
That's very helpful. I hope that when you're done, if you could please share that with me, because I think with us, when you talk about involving men, we've started to do that with gender-based violence, because it's our president called it our second pandemic, especially during COVID. The rates of gender-based violence and femicide in South Africa are astronomical. And I think a lot of the work now in the direction in the last decade so has shifted to involving men. And talking about toxic masculinity, for example, and talking about patriarchy and misogyny, and creating these conversations with men as the focus, because I think similarly to you, that it's the system that maintains the inequality, and so you can't just work with one part of the system if you're hoping for change. But I'd love to hear the outcome of your research. I think that's really interesting.
Mm-hmm.
My last question to you: how do you know that your work in mental health is having a positive impact?
It's about quality, a shift in how people engage with the world, and also about the ripple effect that might have. Say, for example, I had been working in private practice and I saw 5 people. I'd hope that the shifts and the support they get in their therapeutic space would allow a shift and a ripple effect in their life, which hopefully would allow a ripple and a shift in generational engagement in terms of interaction and understanding and support of mental health. So I think that any work in the area is important work, and imagine that there are statistics to prove that implementing prevention, which is why prevention is a primary mode of engagement in terms of mental health, implementing prevention strategies has a definite effect. And when Saima was talking about, we spoke to men about this and then they did come. So similarly, I think within the research field and prevention and mental health within Africa, the shift has been about that. It's about changing one mindset. It's about changing a family mindset. It's about then filtering through to communities. And I think it makes an impact regardless of the number, because I'm more interested in sometimes in some respect individual work. If I've worked with you and that's made an impact to you and your family and your children, then that will entail that you interact with others differently. So we can't always quantify the changes it can potentially make in people's lives.
Saima?
No, I completely agree. Like she took my words. Like it's absolutely, because impact in terms of mental health is because if you're shifting one's mind, I think that's an impact to the whole family. If a woman, and I've seen in my experience, if a woman thought that displacing my frustration on my child was not right, and I know women saying to me when I was doing my master's thesis in another community of women, and they said, when I raised my hand on my child, I remember your words, and I didn't do that. So I think those small positive shifts in one person brings a lot of difference in the whole family. The child development is strongly associated with women's mental health, and this is one of the reasons that I got interested into that, because that intergenerational association, that if a mother is mentally healthy, she can rear a mentally healthy child. So this is the responsibility for the whole society. If you are raising one person who is mentally healthy, who is strong, who knows how to cope with these situations, who knows what are my capacities and abilities, I think you are giving a greater contribution to the society. So I think in terms of statistics numbers, of course, they do matter, because most of my researchers are like from quantitative background. It does matter, but looking to those ground realities in the field, those smiles on women's face, they cried when you leave them, they say, no, we want more. I mean, this is the lifetime experience. We have never thought about it, that we could see this shift in us. I think that has a huge impact. Yeah, so I hope to continue and sustain those at a larger scale.
Thank you very much, Saima and Serena, for sharing with us all your work, and congratulations on your accomplishments. Now, we'd like to open the floor for questions from the audience.
We've already started receiving questions, and the first question that's come in is for both Saima and Zorina. I have a relative who suffers from mental health and who is currently struggling with the decision about whether or not to have children, in fear he would pass the illness on. You both talk about breaking the pattern of dysfunctional behavior across generations and promoting good mental health. How does this work in practice, and what advice might you give my relative? Either one of you can go.
I'll go first, maybe, if it's fine right now with you. Okay, yeah, it's a great question, and I would say it's a natural worry that most of the people who experience mental illnesses think about it. I would say the first and foremost important thing is to understand that your child might inherit your disease. This doesn't mean that they will. This is same as, with any other physical illness, like with cancer, with hypertension, with diabetes. These all major illnesses have a significant genetic risk associated with that. So same is the case with mental illness, right? But the important thing to understand about mental health is, and the recent evidence also supports that, that nowadays, most of the mental illnesses are categorized under realm of environmental health, because it's a combo, it's a combination of genetic and environmental factors, right? And when we say environmental factors, that not only includes physical environment, but also the psychosocial condition that the person is living in. So there are many people who have mental illnesses, but they don't have strong family history. So this is something that people need to understand. But with that, I would also like to take this opportunity to talk about, three important things, and I would be brief in my response, just a high level things that parents who have mental illness, what could be some of the key essential things that they need to consider. Parenting generally is tough, we know, right? Those of us who are parents here, we know it's not an easy task. All parents navigate challenges around child rearing, and when there's a mental illness associated with that parenting, it becomes harder sometimes to connect with childcare. So first thing is that seeking support. Social support was one thing that I took in my doctoral dissertation, where MMEG has supported my work. And I'm a pro advocate for this phenomena, that social support is very important. Support from families, support from trusted friends, support from mental health professionals, nurses, GPs, psychologists, psychiatrists, community services, counselors, social work, whatever support is available. It is perfectly okay to accept help. Sometimes there's a stigma around that accepting help and seeking help is a sign of weakness, but it's not. It's actually a sign of strength, that you know what you need and you are making efforts to get that help. So it's perfectly fine to seek help and to accept help. Number two is acknowledging your own disease as a parent with mental illness. Giving your 100% to your self-care, to your compliance, to your medication, your treatment, having follow-ups, whatever is required to deal with that disease is very important. And number three is, whenever it is appropriate, talk about your illness with your child. Be open with them, because this is very important, so they can understand that what therapy are you getting, or maybe they can expect some fluctuations in your behavior. So this is important, but this can be tough. So again, help from a mental health professional could help you. And there are many resources available by WHO, by NIMH. There are public documents on internet which help you even at the time when a couple is planning for a child, right? It's before pregnancy. So go and take those counseling helps. I think these are very important. So come out, so talk about mental health is something we need to now be living in. Talking about it, there is no harm in talking about mental health. As much as we will talk about it, there's going to be more awareness in public and communities.
Zorina, do you want to chime in?
Yeah, I have a few things that I was thinking about, and Saima's touched on a lot of them. But the one thing is that mental illness is not an umbrella term. And so depending on what it is that this relative is suffering from, who determine the way you work with it. So there's a stronger genetic component, as Saima said, to some mental disorders as others. So it's really important to be informed about that. But I think that in terms of, if someone is coming to you thinking about what would this mean for my child, it shows a reflective capacity on the part of the parent, on the part of this relative who's thinking, what would it mean to them? And so I'd be keen on understanding, what has it meant to you? Because what we need to think about with parenting particularly is yes, there might be a genetic component, but that parenting and a secure attachment relationship would do wonders in terms of building resilience, so that a child who presents with whatever mental illness that you imagine he might have inherited from you might be in a better place of managing it and having a fully functional life. So it's not a sentence, as Saima said, there are medical disorders that have a genetic component, and similarly, some mental disorders have more of a genetic component than others. But I think it's important because secure attachment in parenting has been shown and proven to change the trajectory of children's physical and mental and emotional well-being. So building resilience, building an emotional capacity with your child, so that whatever it might be that they do or do not have, they will work through it or resolve it or be more functional perhaps than you were able to do because you didn't have the information you needed. So the biopsychosocial model for me in terms of understanding mental illness is really important. And that it doesn't necessarily mean that even a child with the same mental illness as you would necessarily follow the same trajectory or suffer the same challenges or dysfunction that you would.
Thank you. We have several other questions. I think I'm going to put two, they're coming from different people, but two of them together. The first is being mentally healthy the same thing as being happy, or is it simply the absence of mental illness? That's one question. Completely separate question comes from does creating a platform for sharing stories, is that a sustainable way to reduce mental health problems?
Zorina, would you like to go first, or do you want me to?
I don't mind. Just some thoughts, Simon. I think you can add in when you think, when you have something to add to it. So I think there's been a shift in thinking about mental health in terms of an absence of ill health or an absence of disorder, and more about thinking about what does it mean to have good mental functioning. So it's about being physically and emotionally well. It's about being functional in your life. It's about contributing to society. And it's about managing those normal day-to-day stresses that most people have to face. So for me, mental health would mean how well are you able to do those things? It's not necessarily just an absence of ill health. And in terms of creating a platform for sharing stories, I think part of what that creates, and Saima did really well when she shared this with us with her PhD, is that creating an environment where that allows one to demystify the stigma that's attached, and this goes into stigma again, to demystify what mental health and ill health is a very good way at a community level of creating conversations about things that are held in our home, for example. So my mother, I grew up with her and she's depressed, but we don't talk about it. Until you allow a space for women or people to have the conversations. Oh, but we also went through that. And there's something in normalizing it that makes people more open to understanding that it is not a life sentence. It is not something that would, necessarily predetermine your trajectory or your course of life or your quality of life. And having conversations and creating spaces, I think, provides a valuable point, because when we're working with communities, especially, they don't have access to webinars like this where they can find information. They don't have access to resources and learning. It's about the conversations they have with each other. So using that, and Saima was saying earlier in a talk about how valuable what value there could be in having spaces where there is nothing, to develop ways of being and doing. And in South Africa, a lot of the work is done in communities by people in those communities who are enduring certain hardships or certain trauma. And it's through conversations with each other that there's an empowerment in that, I think. And there's something that shifts within those communities who are able to support each other through this, from the understanding that no one else would understand this trauma because no one else has experienced it. And I think there's a great value in that to talk to stigmatization also, and sustaining how at a community level, within the family, how people demystify the perceptions of mental illness.
I would add to what Zorina just explained in response to the first question. What is mental health to me? I completely agree with what Zorina just mentioned, but just would like to add something into it, that sometimes there's a general misunderstanding that people think that patients or people who are experiencing mental illnesses, they are no more mentally healthy. In fact, this is not true, right? So people who are having mental illness, they can still have that subjective sense of, even higher sense of well-being. Okay? So as Zorina explained, that it's totally not only absence of disease, it's how well you are aware of your own abilities and capacity to be functional and to contribute to the society. Another thing that I would like to add here is, sometimes with situations, there are bad influences, bad situations in everyone's life. I mean, you cannot be happy all the time. This is humanly impossible, right? You can be sad, of course. This pandemic is causing a lot of negativity, frustration, and stress in us. So that's fine. It is okay sometimes not to feel okay. I think we need to acknowledge that. And that doesn't mean that I am having mental health issue, because for a human being, it is appropriate to exhibit situational appropriate responses. If there's something going on which is very a happy event, I have to be happy, right? If there is something going on which is not which is a sad situation, something bad is going with someone, absolutely I would feel bad from inside. But the problem comes when this one kind of emotion is there for a long period of time, and that's disturbing your daily functioning, that now I cannot come out of that emotion. I'm still stuck there. I cannot pay attention to my work. I'm no more functional. I feel like to be isolated and crying. And you feel that it's going on for a long and long time, that then a person requires help. But situationally, for a short period of time, it is perfectly fine to not to feel okay. But acknowledging it is a key. Acknowledge it. Okay, I'm going through this. This is okay. What can I do for that? I think this is what we need to understand as far as mental health is concerned. And in response to the second question, platform for sharing stories as a sustainable way. So far, this is what evidence tells us. And this is what my research shows, that when women got a platform, an open space to talk and exchange their frustrations and their negative emotions, it created a space for positivity. So they learned from each other. So that's, of course, a key to it. And also what a counselor does, what a psychologist does when a person with a mental illness goes to them, they allow them to talk. What are you going through? Just they give them the space to talk. So similarly, in a community setting, and in the context of developing countries where psychologists and psychiatrists are very expensive, every person of those regions cannot afford that, right? So having these strategies at a community level, at a primary care setting level, can definitely bring a significant difference. Over to you, Reiko.
Thank you. I think you've both answered the question I was going to ask next, which is, how can we fight stigmatization? You've definitely been addressing this, but I want to acknowledge receiving that question. Some more questions are coming in. One is, what is the best time or age to talk about mental health?
I smiled when I saw that. I smiled when I saw that question, Carmen. I love it because birth. I think we need to raise, and so that's why I'm interested in parenting. It's about raising children and creating a language, making a normalized language about feelings, identifying feelings so that they can identify what's happening inside of them, about helping and teaching coping strategies and developing ways of healthier management so that it doesn't lead to later dysfunction. So my area of interest right now is attachment, and what that talks to in building secure attachment relationship with children is having those conversations so that they can develop the capacity to regulate themselves emotionally. And I think that is part of mental health, and that needs to be there very early on. And so there's a lot of work done in the infant mental health field that looks at helping and supporting mothers to develop that way of engaging from infancy, so that they're able to identify their children's feeling state, they're able to contain it for them so that children eventually develop that capacity for themselves. So Carmen, yes, for me, it's as soon as they are born, to engage with it, not not like in the way that I think we imagine we would talk about mental health, but just engage with emotional well-being and managing difficult situations and building resilience. Because one of the key factors in building resilience is secure attachment relationships and positive feelings. So giving them the kind of environment, I think, that allows for that would definitely help in the long run and help them navigate through a life that is more functional, where they're more attuned to their own mental states and emotional states.
I would say even before birth, there are many studies, that are investigating like the prenatal mother's mental health connection with their newborn that's coming to the life. So, and according to the Erickson, Zorina is a psychologist, I like the psychosocial stages of Erickson's development theory that says that trust versus mistrust that comes when a child is in its infancy stage. So whatever connection, the trust that the child develops with their parents or mother in that as early as possible is better for their mental health. Mm-hmm.
Next question. You both refer to learning about strategies that women use in coping with mental health issues that surprised you and that you don't read about in textbooks. Could you give us some examples of what you found?
Sure. I would say I would like to put in a way that those were some characteristics or attributes that I saw in women. So during my work with those communities, like I had met at least 1 to 2 women in each research setting who were very, very strong. And I still remember them, after five or 10 years, because I have learned a lot from them. And the main highlighted attributes I would say that reflected their strength were their ability to acknowledge the circumstances. So they were very well aware about their protective versus risk factors. They knew that there are things in their life that they could change. There are things that they couldn't, and they have to accept it. So despite having those abusive relationships, no financial independence, no education, very low to no support, the external support, they knew this is not how I want to spend my life. So for example, like I met one of the women who I remember she was living with her husband and her children, and her husband's second wife and her children. So it was a chaotic house, a very small house, but too many people living together. And she said, like, she was very frustrated initially, of course, and they were having daily fights and conflicts. And whenever her husband used to come after work, she started talking about her own frustrations and issues and fight between those two wives, and then that the husband is not paying attention to the family and kids. So every evening, she said, we had a fight, and then husband used to physically hit her. And she started noticing the same behavior in her children. And when I met her, she was very concerned about it. She said, at one point, like I was okay, I thought this is how my husband is, but since my kids have started screaming back to me and they are showing the same aggression towards me, this is not what I wanted, and I don't want them to develop these and as a mother is very sensitive, right, when she observes such behavior in her children. So she said that she herself started modifying her behavior. She said there was a time when I said, now enough is enough. Now I have to do something about it. So she said, now what the strategy that she has adapted was, she said, instead of now sharing my frustrations the moment my husband comes into house and I started, so I have changed that. So what I do now, I offer him a glass of water when he comes home. I give him some time to relax and rest and take rest. I feed him well, and then I don't talk about my issues and frustrations for about an hour or so. And whenever he is okay, he's settled, then I start talking about it, and in a way that doesn't make him aggressive. And she says, like, it worked like magic. Of course, she said, still, like, sometimes it happens, but the frequency of that abusive fights and hitting, and it has really gone down. And she has seen this difference. So she taught that to that group of women from her own experience, which I thought, I mean, if you are living, I could imagine in that situation, it's really hard to come out of that. Another thing that I noticed in those women were they were very good in finding their own strengths. And, they knew how and where to seek support for that. And the third thing was having a persistent behavior. So they didn't give up. And as I said, I met like hundreds of women, but only one or two women were like who highlighted, who were standing out in those groups. So this is, I can tell that this is an internal strength, the example of internal resilience that they capitalized on. Yeah, so I hope I answered that your question, Reco. Yeah.
Zorina, do you want to share anything? Or...
Yeah, I was thinking about also my research and working with women, and I went in there wanting to look at psychological abuse, which I think doesn't get enough attention, because there's so much attention given to physical abuse, and so the underlying components that aren't overtly observable is an area that women themselves that were being abused weren't aware of. So they didn't identify as psychologically abused, but they kind of ticked all the boxes for abusive behavior. And what was interesting for me is how, and really dire, really traumatic life histories, really dire circumstances, reliant on their husbands for a roof over their head because they weren't working, and, just drug use and gangsterism in the area. So I was humbled by the capacity to manage. And so when I think about resilience, I also think that how would I have coped in that same situation? What would I have done? And I think it came down to survival for them and their children. And so many of these women were saying to me, the reason I can go on is because I don't want the same life for my child. That I don't want this for them. And so I have to stick around. I have to be, and I have to survive this so that I can create a different future for them. And what they drew on, and I went there specifically looking for Muslim women and looking at Islam, but it wasn't even Islam per se that they were drawing to, but almost as though there was this spiritual power or being they were accessing that helped them endure. And this endurance was about, this can't be like this forever. This can't be my life forever. If I get through this moment, if I get through this day, if I take this beating, it will get better. And hope, I think that was the most unexpected thing, that I wouldn't have imagined with these stories and the lives they'd lived, that they'd be able to hold on to hope, but they did. And I think the hope resided in their children and wanting a really different life for them. So, yeah.
I think you sort of alluded to this, but the next question is, do you think governments take mental health as seriously as they do physical illnesses? And is there the same amount of money for its research and cure?
So I don't know about you, Saima, but not in South Africa. I think there's been a change. There's definitely been a shift, but by no means do they take it, I think, or invest the same kind of resources into it as they do in physical illness. And that's a pity, because the repercussions of it on society and the public health system is enormous. If we think about people not going into work because of mental health difficulties and money getting lost in that process, if that's what they were concerned about. If we think about so South Africa has, Cape Town especially, there's a gangsterism, there's unemployment, there's juvenile incarcerations, there's children being shot every week. There's a child caught in the gang fire almost every week. It's just, and I think if we think about where that stems from and what that's about, I think there's a component of mental illness or mental ill health in that. The reliance on substances, the joining gangs, and the violence that comes from that talks to a traumatic history that is ours, but also this intergenerational transmission of trauma that gets passed on and people manage differently. And I think there definitely has been a shift, but I don't think enough, I think, to meet the needs of what's happening on the ground here.
I agree with Zorina, and same is the case with Pakistan and other developing countries where mental health is still, unfortunately, not given a priority. And there are very few trained people, psychiatrists, psychologists, mental health nurses. There are very, very few people who are there to serve to that huge population living in those regions. So yeah, and we wish that because mental health is everyone's responsibility. I keep saying that mental health is definitely an individual responsibility, but the same responsibility goes to the society and community and government for providing resources. And that's why I've mentioned about the treatment gap. Over a decade ago, it was about 90%. So when people who are not, who need treatment, they were not able to get those treatments. So prevention is still so far. I mean, we haven't reached there. Yeah, so government has to really pay attention to this.
These are the last questions that I'm going to be asking you off of the chat. There are two different ones, but one is, although the last question was about government and money, this other question is a slightly different take. Do you think mental illness is portrayed accurately in the media? Is it shown too much or not enough? And slightly separate from that, another question is that is in sharing stories within communities, has that led others to be able to identify a mental health condition that could otherwise have been missed? It seems that sharing stories both destigmatizes and provides safety benefits. These will be my last questions, because after both of you speak, your final words, then I'm going to have to close my part and pass the mic over to our president.
So I want to answer the question about sharing stories. And I think working at a psychiatric hospital for children and adolescents, I came across that so often, where mothers who'd come to us saying that I'd always thought my child was naughty, or that he was just very active, or he just didn't know how to behave, until someone said to me, maybe he's got, say, for example, ADHD, maybe there's a learning difficulty. And so I think for me, that has definitely shown itself in how people can learn. They don't always have access to psychologists and psychiatrists, but the people around them who are engaged in some or other form of mental health and are more educated or more aware, can really open their eyes to what potentially was not just a naughty child, but someone who actually needed perhaps medication to help manage whatever neurological difficulties they had. So I believe in that, and I believe in the power of the community and the work that the community does when health professionals aren't always accessible. And that's why it's so important, I think, to create these spaces for conversations at a community level, so that awareness is raised. So it's not a naughty child, but it's the child that has a difficulty that needs a different kind of treatment than corporal punishment, for example. I don't know about your experience, Saima.
No, I agree. I have several stories of women who have, especially I remember a couple of women who were having some sort of mental health issues, and they didn't know about it unless they come to the group and started talking. And then offline, I communicated with them, and it opened like it was a big issue, and then they were helped accordingly. But what the question is saying, that it seems that sharing stories, of course, destigmatizes, and women also get to know, okay, so I'm not alone. You know, there are other women too who are going through this, or maybe it has happened to someone, and this is how she has coped, and she is now successfully running her life. So this is, in a way, is a way of support that, okay, I should not stop here. I could do something about it. So definitely, it gives that safety net, simultaneously a support that I'm not alone in this journey, and also providing them a platform to talk about mental health. It is okay to talk about it. So yeah, and I think, Direko, your second question was about the media. Unfortunately, for like past so many years, if I talk about the media in Pakistan, it was not very well portrayed. I mean, when I was a student and in my teen age, then people think most of the time, then it's still, I'm sure there are some people who think that they don't think this is an illness. Sometimes they think they relate it to some faith-based consequences, or maybe I've done something bad, that's why I'm having these problems with me. So the symptoms like hallucination, illusion, they think that there is a bad spirit in me, and this is, so they don't recognize it as an illness, that this is a disease and it needs treatment. And media has unfortunately promoted that picture too in many of the instances that I have witnessed. But these days I'm seeing little shift in somewhat, for example, a current drama series that just got over on Pakistan's media, that actually very well portrayed a story of a woman who had schizophrenia. So how her husband is supporting her and trying to understand the treatment, the importance of compliance and the symptoms that she must be expecting. So there is awareness coming, but overall, generally, if you say, still media has to play a great role into that this is same as any other physical illness, and there is a treatment, and people with mental illness could lead a better life too.
It's been fascinating to listen to both of you, but an hour has already gone by, which was our allotment. So I hope that we have another opportunity, but I'm so happy that our small grant has made it possible for us to contact and speak with you, for us to listen in on your discussion between the two of you. And now I'm going to pass the mic over to Madeleine. Mike, virtual mic.
Thank you, Reiko. I'm glad you used the word you were happy, because isn't this wonderful that we can all sit here and talk about this, and there's not enough minutes in an hour for us to discuss even closely. The pandemic also shows us what's the awareness of mental health. And in that way, it is a good thing. And it's wonderful that we are able to talk about and address mental health. And that's a big, huge step forward. If I think of my student years, how mental health was really not something that, you spoke about. And I want to thank our grantees for this precious contribution that you give to society. And that's why these women do build a better world. And Pelin, would you please just play our video for us so that we can remember who Meg is? To all of our guests, thank you so much. And we will see you next month when we talk to many of the grantees who will be doing that.
1981. It all started with an idea. Find one exceptional woman, and she'll change the world. So we started small, with one grantee. Today, we've backed 460 from 75 countries. Esther became a Supreme Court judge, changing women's rights laws in Uganda. Malady makes influential films about social topics in India. And Josefina's organization improves the health of Nicaragua's most vulnerable. Our sincere gratitude to our volunteers, donors, and friends. We've done a lot in 40 years. And with your help, we'll do a lot more.